Okay, saline versus silicone, one of the most common questions we get when we talk to patients, at a party or if it's just at a consult, right? Other than size, should I get saline or should I get silicone? Well, there are a few differences, but it's not about shape. It's not about look. There are silicone implants and saline implants that are flatter, made to look more natural, or roundest to give the best, push-up look. So it's not about that. It's about a lot of other things, and that's where it gets confusing. I try to keep it pretty simple. 2 advantages for one and 2 advantages for the other. With saline, one advantage is that it's a lot less expensive. A set of these is about $1,000 less than a set of silicone implants, right? So that's one advantage of saline. The other advantage is, well, an implant can get a hard scar tissue capsule around it, right? That's when it goes from feeling nice and soft and natural to like hard. You can feel when you hug someone. Usually it only happens to one side, so you get asymmetries from that. Well, it turns out that saline implants, in addition to being less expensive, seem to have a lower chance of that capsular contracture, right? So those are your 2 advantages to saline. Silicone has the advantage of feeling, not looking, feeling more natural. It kind of feels like fat or soft breast tissue, and some are firmer than others. See, there are some different options there, versus saline, where it can feel a little bit more like Ziploc freezer bag with water in it. Now, you don't feel it up here because the muscle, it's usually at the bottom and to the side where there is no pec major muscle, because the implant pretty much should be under the muscle. Okay, there's another advantage to silicone in that it's stronger. It's less likely to rupture. Saline implant ruptures, that's pretty obvious, it's gone. Silicone implant ruptures, well, 2 things. One, it's less likely to rupture, and if it doesn't just leak out like goo. Here's an implant that I cut in half, and you can see it kind of stays together. So sometimes you might not even know if it's ruptured. It's a little harder to tell. So I would say advantages and disadvantages. Saline, less expensive, lower capsular contracture rate. Silicone, more natural feel, and lower rupture rate. If you have a lot of breast tissue and the implant's not going to be really big, I think saline is a great option for a lot of patients. If it's all about feel and you don't have a lot of breast tissue and you want a bigger implant so you're really going to be able to feel it, I think silicone makes a lot of sense. Hey, that's a simplification, but that's what I think is kind of the easiest way to think about the differences.